Have you ever looked at an egg and thought, I'll just eat the white? It's the healthy part? Like seriously, eating only egg whites on an empty stomach, you're not alone. Many people, especially those over 60, have embraced this habit in hopes of avoiding cholesterol and protecting their heart. It's a trend that's persisted for decades, fueled by diet culture, misunderstood nutrition advice, and fears about cholesterol. But what if I told you that by doing this, especially first thing in the morning on an empty stomach, you might be sabotaging your health in ways you never imagined? Let's break this down. Egg whites are often praised for being fat-free and high in protein. That's true, they contain about 6 grams of protein and virtually no fat or cholesterol. On the surface, they seem like a clean, lean source of fuel. But egg whites also contain a protein called avidin, and that's where the trouble begins. Avidin binds tightly to biotin, also known as vitamin B7, an essential nutrient that supports everything from nerve function to skin health, metabolism, and even your mood. When avidin binds to biotin in your digestive tract, it prevents your body from absorbing it. Now, if you occasionally eat egg whites, this might not be a major concern. But when this becomes a daily habit, especially on an empty stomach when your gut lining is more acidic and prone to quick absorption, avidin can have a magnified impact. It effectively grabs the available biotin and flushes it from your system. Over time, this creates a nutritional deficiency. And for older adults whose nutrient absorption is already compromised due to age, the consequences can be significant. Let me tell you about Eleanor Thompson, a 72-year-old retired nurse from Maine. For years, she had started her day with 3 egg whites, skipping the yolks entirely. She believed she was doing everything right, cutting calories, avoiding cholesterol, and staying fit. But slowly she began to experience numbness in her fingers. Then came fatigue, mental fog, and a tingling sensation in her legs. At first, her doctors thought it might be neuropathy or early Parkinson's, but further testing revealed the true culprit, a biotin deficiency, directly linked to her long-term egg white-only diet. After reintroducing whole eggs and taking biotin supplements, her symptoms gradually improved. But the experience was a sobering wake-up call. This isn't an isolated case. Let me introduce you to another real-world story. Carlos Ramirez, 68, from Southern California. Carlos was diagnosed with prediabetes and started following an ultra-clean diet recommended by an online wellness influencer. His morning routine? 2 raw egg whites blended with spinach and a tablespoon of flaxseed. No yolks, no carbs. Within 6 months, he developed severe fatigue, dry skin, and depressive episodes. Blood tests showed dangerously low levels of biotin and vitamin B12. A nutritionist finally uncovered the issue: chronic avidin exposure combined with a lack of dietary fat and key micronutrients from egg yolks. Once Carlos started eating whole eggs, especially paired with fiber-rich vegetables and healthy fats, his energy and mood rebounded. His blood sugar even improved due to better metabolic function. Here's the science. Egg yolks aren't the villain they were once thought to be. In fact, they're where the real nutrition lives. Each yolk contains not only biotin, which helps counteract avidin, but also lecithin, omega-3 fatty acids, vitamin D, choline, lutein, and zeaxanthin. These nutrients are critical for brain health, memory, vision, hormone balance, and even immune support, especially for older adults who are already more vulnerable to cognitive decline and nutrient deficiencies. In contrast, removing the yolk strips the egg of most of its benefits. You're left with protein, yes, but you're also inviting problems like poor fat metabolism, impaired cell communication, and increased risk of nerve-related symptoms. Why? Because fats and fat-soluble vitamins from the yolk help transport and activate many of the nutrients you're trying to get from your diet in the first place. Even more concerning, consuming egg whites on an empty stomach increases stomach acidity. In this acidic state, avidin's binding to biotin becomes even more efficient. So, not only are you skipping the yolk's biotin, you're amplifying the biotin-depleting effects of avidin. So what can you do differently? First, eat the whole egg. Yes, yolk and all. The cholesterol in egg yolks has a minimal effect on blood cholesterol for most people, especially when eaten in moderation. In fact, the cholesterol in food does not necessarily translate to cholesterol in your bloodstream. The liver adjusts its production based on what you eat, and in healthy older adults, moderate egg consumption, about 5 to 7 per week, is not linked to heart disease. Second, avoid eating eggs on an empty stomach. Instead, pair your eggs with fiber-rich foods like steamed vegetables, leafy greens, or a slice of whole grain toast. These foods buffer stomach acid, improve nutrient absorption, and help stabilize blood sugar. A win-win for seniors watching their heart and cognitive health. Third, eat your eggs as part of a larger, balanced meal. Timing also matters, as you'll see in an upcoming section. And it's best to avoid eggs during early morning hours when digestion is still slow and cortisol is high. In summary, eggs are only as healthy as how and when you eat them. So the next time you reach for that bowl of whites, remember this. The yolk isn't the enemy, it's the missing piece. By honoring the whole egg and respecting your body's rhythm, you can turn this humble food into a daily ally for vibrant aging. Number 2, eating raw or undercooked eggs. Many of us have grown up with stories or traditions that include raw or undercooked eggs. Maybe it's a family recipe passed down from your grandparents, a post-workout protein ritual, or even a nostalgic memory of watching boxers like Rocky gulp raw eggs to build strength. While it may look bold or health-savvy, the reality, especially for older adults, is much more dangerous than it seems. Eating raw or undercooked eggs might feel like a shortcut to nutrition, but this seemingly harmless habit carries serious consequences that can go unnoticed until they cause real harm. As people age, their digestive systems become less resilient, and their immune systems weaken. What the body once tolerated without issue may now trigger infections, nutritional deficiencies, or long-term complications. The hidden threat, salmonella. One of the greatest risks of consuming raw or undercooked eggs is salmonella, a bacteria that can live both on the eggshell and inside the egg. This is not just some rare or outdated concern. According to the CDC, salmonella causes about 1.35 million infections and 420 deaths annually in the United States alone, and a disproportionate number of these hospitalizations involve seniors over the age of 65. Why are seniors at such high risk? Because their immune systems, which help the body fight off infections, are no longer as robust. A younger person might battle a salmonella infection with just a few days of discomfort. But in someone older, the bacteria can quickly lead to severe dehydration, fever, confusion, hospitalization, and in some cases, even sepsis, a life-threatening condition where the infection spreads throughout the bloodstream. Take the real-life story of Mr. Mark Thompson, an 82-year-old retired teacher from Kansas. Every morning for over a decade, Mark started his day with a raw egg drink. 2 eggs, a spoonful of honey, and a splash of vodka. He swore by it, claiming it kept him energized and sharp. But one summer morning, he began feeling weak, nauseous, and disoriented just hours after his usual breakfast. He was rushed to the ER by his daughter. After several tests, doctors confirmed he had salmonella sepsis and INFI. The tragedy? It was entirely preventable. Even if you avoid raw egg beverages, eating undercooked eggs, such as soft-boiled eggs with runny yolks, sunny-side-up styles, or undercooked poached eggs, still puts you at risk. Bacteria that survive the cooking process can flourish in the digestive tract, particularly when the immune system is unable to respond aggressively. And remember, just because an egg looks clean doesn't mean it's sterile. Salmonella contamination can occur even in eggs with no visible cracks or odor. Avidin and biotin. The nutritional trap beyond infection, there's another issue, biotin depletion. A protein found in raw egg whites, known as avidin, binds with biotin, vitamin B7, in your digestive tract and prevents it from being absorbed. In raw or undercooked eggs, avidin remains active. Over time, consistent biotin deficiency can lead to a slew of complications: hair thinning, skin rashes, fatigue, muscle pain, depression, poor memory, and even balance issues. Consider Lucille Jennings, a 76-year-old grandmother from Georgia. A lifelong fan of soft-boiled eggs, she enjoyed them with toast every morning. Over several months, she began noticing that her hair was falling out in clumps. Her knees ached constantly, and she often felt mentally foggy. She was referred to a neurologist and rheumatologist. Blood work eventually revealed severely low biotin levels. Lucille was never told that her beloved runny yolk eggs could be robbing her of this critical vitamin. Oh. Biotin is essential for nerve health, skin regeneration, fat metabolism, and even gene regulation. Seniors are already at a higher risk of nutrient deficiencies due to decreased stomach acid, slower digestion, and medication interactions. Losing out on biotin because of avidin activity simply adds insult to injury. Impact on the gut microbiome. There's also a more subtle, but deeply impactful, consequence of eating raw eggs: disruption of the gut microbiome. The human gut is home to trillions of microorganisms that control digestion, mood, immune function, and even cognition. In older adults, this ecosystem becomes more fragile and susceptible to imbalance. Raw eggs can introduce not just pathogens like salmonella, but also undigested proteins, which irritate the gut lining and may feed harmful bacteria. Over time, this leads to a condition known as gut dysbiosis, associated with inflammation, brain fog, depression, weakened immunity, and increased vulnerability to diseases like Parkinson's and Alzheimer's. It's not just about stomach upset. This is about long-term health. How to stay safe. Fortunately, avoiding these risks is simple with the right precautions. Cook eggs thoroughly. Ensure the yolk and white are fully set. Boiling eggs for 9 to 12 minutes is ideal. For fried or scrambled eggs, make sure the texture is firm and there's no runniness. Avoid raw egg recipes like Caesar dressing, cookie dough, hollandaise sauce, or homemade mayonnaise unless made with pasteurized eggs. Pasteurized eggs are treated to kill bacteria without cooking the egg itself. Check your eggs. Don't use eggs past their expiration date. Discard any with cracks or discoloration. Store eggs at 40 degrees Celsius, 4 degrees Celsius, or below in their original carton, away from raw meat. Be cautious in restaurants. Always ask how eggs are prepared. Some meals may use partially cooked eggs or dressings made from raw yolks. When in doubt, opt for fully cooked dishes. Wash your hands and utensils after handling eggs. Salmonella can transfer to other foods or surfaces quickly, increasing contamination risks in your kitchen. If you've been regularly eating undercooked eggs and now notice symptoms like chronic fatigue, numbness, recurring gut discomfort, or brain fog, it's worth discussing this with your healthcare provider. Simple lab work can identify nutritional gaps, especially biotin, and adjustments to your cooking habits can restore health over time. In conclusion, while raw or undercooked eggs may seem like a traditional or harmless choice, they pose real dangers for older adults. From infection risks to nutrient deficiencies and gut microbiome disruption, the risks far outweigh any perceived benefits. By making one simple change, cooking your eggs thoroughly, you protect yourself from long-term harm and unlock the full nutritional power of this incredible food. Number 3. Consuming eggs with certain medications. Eggs are a nutritional powerhouse, rich in protein, vitamins, and healthy fats. But for seniors taking daily medications, consuming eggs without understanding how they interact with certain drugs can quietly sabotage treatment plans. As we age, it's not uncommon to be prescribed multiple medications, from blood thinners and antibiotics to thyroid supplements and iron. While eggs offer many benefits, timing matters, and what seems like a healthy meal could be interfering with your body's ability to ab. How eggs interfere with medications. Let's explore 5 common classes of medications and how eggs can reduce their effectiveness or even cause side effects. 1. Blood thinners, e.g., warfarin. Warfarin is commonly prescribed to prevent strokes and blood clots. It works by limiting the activity of vitamin K, which plays a critical role in blood clotting. Here's where eggs come in. Egg yolks are naturally high in vitamin K. Eating eggs in large quantities or suddenly changing your intake can interfere with warfarin's effectiveness. Too much vitamin K may reduce the drug's ability to prevent clots, while too little might cause excessive bleeding. A consistent intake of vitamin K is key, but most patients don't realize that sudden increases or decreases in egg consumption can make warfarin dangerously unpredictable. 2. Antibiotics, e.g., tetracycline quinolones. Eggs contain minerals like calcium, magnesium, and iron that can bind to antibiotics in your stomach and prevent your body from absorbing them properly. These antibiotics form insoluble complexes with the minerals, meaning your body ends up flushing them out before they can do their job. The result? Prolonged infections, the need for stronger antibiotics, and in some cases, antibiotic resistance. 3. Iron supplements. Egg whites contain a compound called phosphate, a protein that binds tightly to iron and prevents it from being absorbed in the intestines. This is especially problematic for seniors, many of whom suffer from anemia. If you take an iron pill and eat eggs shortly afterward, you could be reducing the supplement's effect by up to 50% or more, and never know why your fatigue, pale skin, or shortness of breath isn't improving. 4. Thyroid medication, levothyroxine. This medication must be taken on an empty stomach for maximum absorption. Eating protein-rich foods like eggs too soon afterward can block its uptake, making you feel tired, sluggish, or moody, signs that your thyroid hormone levels aren't stabilizing. Doctors typically recommend waiting 30-60 minutes after taking levothyroxine before eating, but many seniors skip this step without knowing how critical it is. 5. Cholesterol-lowering drugs, statins. While there's no direct blockage, high-fat meals like those with eggs can affect how your liver processes statins. Some types of statins require a low-fat environment to work efficiently. Mixing the two regularly, especially if you eat fried eggs cooked in oil, can reduce the intended benefit and lead to continued high cholesterol levels despite medication. A real-life example. Harold's story. Take the case of Mr. Harold Smith, an 85-year-old retiree from Florida. A disciplined man, Harold took his morning medications with a breakfast of 2 boiled eggs and toast. These included warfarin for atrial fibrillation and iron supplements for anemia. Despite faithfully following doctor's orders, he began experiencing spontaneous bruising, dizziness, and shortness of breath. His lab results showed dangerously thin blood, a low INR, and no improvement in his iron levels. What was going wrong? After a consultation with his pharmacist, Harold learned that the vitamin K in egg yolks was interfering with warfarin, and the iron supplement was being blocked by egg proteins. By simply adjusting the timing of his breakfast, taking his warfarin and iron supplements first, then eating eggs 4 hours later, Harold was able to stabilize his health within a few weeks. Best practices for safe egg and medication timing. Here's how to safely enjoy eggs while taking your daily medications. Wait 2 to 4 hours between medications and egg consumption, especially for warfarin, antibiotics, and iron supplements. Take thyroid medications like levothyroxine first thing in the morning, then wait 30-60 minutes before eating anything, including eggs. Be consistent. If you eat eggs daily, keep the amount and timing steady to help your doctor dose your medications accurately. Track your meals and meds in a journal to identify patterns in energy, mood, or symptoms. Talk to your doctor or pharmacist anytime you add a new food, supplement, or medication to your routine, especially one as nutrient-dense as eggs. Conclusion: eggs are not the enemy, but improper timing can make them an invisible barrier between you and your health goals. By being intentional about when you eat eggs and how they fit into your medication schedule, you can continue to enjoy their nutritional benefits without compromising your treatment outcomes. For older adults, this small adjustment can mean the difference between progress and setback, between vitality and vulnerability. Number 4. Consuming eggs between 6 a.m. and 8 a.m. Eggs have long been considered a breakfast staple. They're versatile, quick to prepare, and loaded with protein, healthy fats, and essential vitamins. But what if the very timing of your breakfast, especially eating eggs between 6 a.m. and 8 a.m., is undermining your health, particularly as you age? It may come as a surprise, but the early morning hours, when your body's internal systems are still waking up, can be the worst time to consume cholesterol-rich foods like eggs. This isn't just about digestion or energy. It's about how your body processes cholesterol, hormones, and nutrients during specific times of day, and how those processes change as you grow older. Let's explore why seniors in particular should reconsider the timing of their egg consumption, and how a simple shift in habit can dramatically support heart, metabolic, and cognitive health. The cortisol-cholesterol connection. Every day, your body follows a natural circadian rhythm, an internal biological clock that controls sleep, hormone levels, digestion, and metabolism. One of the key hormones involved in this cycle is cortisol, often referred to as the stress hormone, but more accurately described as a wake-up and readiness hormone. Cortisol levels peak between 6 a.m. and 8 a.m., just as you rise and start your day. This surge is essential. It helps regulate blood sugar, increase energy, and prepare your body to handle the demands of the morning. However, this natural spike comes with a trade-off. Cortisol also stimulates cholesterol synthesis in the liver. Now imagine what happens when you eat 2 or 3 eggs, foods already high in dietary cholesterol, at the exact moment your liver is being pushed to produce more cholesterol naturally. The result? A compound elevation in blood cholesterol levels, particularly LDL, the bad cholesterol. This effect is especially concerning in older adults whose metabolism has slowed, and whose arteries are more vulnerable to plaque buildup and inflammation. Real-life story: Mr. Ronald Jones. Consider the case of Mr. Ronald Jones, a 78-year-old widower from Ohio. Every morning at exactly 6:30 a.m., Ronald would eat 2 fried eggs with toast and coffee, a tradition he'd followed for over 20 years. Despite maintaining a healthy weight and exercising regularly, Ronald suffered a heart attack during his morning walk. Tests revealed his LDL cholesterol was nearly double the recommended level for someone his age, despite no family history of heart disease. The culprit? Doctors pinpointed his cholesterol-rich morning diet, combined with early morning cortisol peaks, as a major contributing factor. Once he began delaying his egg consumption to mid-afternoon, along with other dietary changes, his cholesterol dropped significantly, and he felt more energetic throughout the day. The digestive system isn't fully awake. In addition to cortisol, another reason to avoid eggs between 6 a.m. and 8 a.m. is that your digestive system is not fully operational in the early morning. After 7 to 9 hours of sleep, your gastrointestinal tract is essentially in standby mode. It needs time, movement, hydration, and light to fully activate. Consuming protein-rich foods like eggs during this dormant period forces your body to work harder to digest and absorb nutrients. For seniors, this can lead to issues such as bloating, indigestion, acid reflux, or heartburn, slower nutrient absorption. All of these issues are more likely if you suffer from age-related digestive decline, including reduced stomach acid, slower gut motility, and weaker enzyme production. Eating eggs later in the day allows your body to handle them more efficiently, maximizing the absorption of choline, B vitamins, and healthy fats, which support brain, liver, and nerve health. Afternoon is the ideal time. Scientific studies and clinical observations now support the idea that eating cholesterol-containing foods like eggs is safest and most beneficial in the afternoon, between 2 p.m. and 4 p.m. Here's why. Cortisol levels are lower, meaning less natural cholesterol production from the liver. The digestive system is fully activated, improving nutrient breakdown and absorption. Your metabolism is more efficient, which reduces cholesterol buildup and post-meal blood sugar spikes. You're more active, helping the body utilize the proteins and fats from eggs rather than storing them. In seniors, afternoon meals also support stable energy, better sleep quality, and improved cognitive function, as the nutrients are timed to the body's natural repair and restoration rhythms. What to eat instead in the morning? You don't have to skip breakfast altogether. You just need to choose lighter, easier-to-digest options in the early morning. Here are some safer alternatives. Greek yogurt with berries and oats. A slice of whole grain toast with almond butter. Oatmeal topped with chia seeds and banana. Tofu scrambled with a small amount of olive oil. A smoothie made with leafy greens, flax seeds, and unsweetened almond milk. These choices provide early-day energy without burdening your digestive system or compounding cortisol's effects. Practical tips to time your egg intake. Wisely, to enjoy the full health benefits of eggs while minimizing cholesterol and digestive risks, follow these best practices. Delay egg consumption until after 2 p.m. Especially if you're over 60 and on cholesterol or heart medication. Avoid pairing eggs with processed meat, like bacon or sausage, in the morning, as this dramatically increases saturated fat and sodium intake. Hydrate and move before eating eggs. Drink a glass of water, stretch, or go for a short walk to activate your digestive system. If you do eat eggs in the morning, opt for boiled eggs paired with high-fiber vegetables rather than fried or scrambled in oil. Track how your body responds. If you experience fatigue, reflux, or heaviness after eating eggs early, try shifting to later in the day and observe improvements. Eating eggs first thing in the morning may be a deeply ingrained habit, but it's one that deserves reconsideration, especially for older adults. Between cortisol spikes, sluggish digestion, and increased cholesterol risk, the early morning window is far from ideal for consuming eggs. By simply shifting your egg intake to the afternoon, you can improve digestion, protect heart health, and enhance nutrient absorption, all while continuing to enjoy the incredible benefits eggs have to offer. So, the next time you reach for that pan at sunrise, ask yourself, is this the best time for my body, or just the most familiar one? Your body might thank you for making a small change with big results. Number 5. Cooking eggs in high-temperature oil, expanded, fried eggs. Sunny side up, over easy. Scrambled in butter or sizzling oil. These are breakfast staples in many homes, comforting, flavorful, and often considered a fast source of protein. But for older adults, cooking eggs using high-temperature oils might quietly be doing more harm than good. In fact, the method you use to cook your eggs is just as important as the eggs themselves. As we age, our digestion slows, our cardiovascular system becomes more vulnerable, and our body becomes more sensitive to the effects of inflammation and oxidative stress. Cooking eggs in oil at high temperatures introduces a series of problems, from poor digestion to increased heart disease risk, especially in seniors. Let's unpack exactly what happens when you expose eggs and cooking oils to intense heat, and how you can make simple adjustments that protect your health while still enjoying your favorite food. What happens when you fry an egg in high heat? When you crack an egg into a hot pan with oil heated past its smoke point, the temperature at which the oil starts to break down, several chemical reactions take place. The egg proteins become over-denatured, meaning they lose their natural shape and become rubbery. Nutrients like choline, lutein, and B vitamins begin to degrade, reducing the egg's nutritional value. The oil starts producing toxic compounds, including aldehydes, which can damage DNA and proteins; acrylamide, a possible carcinogen found in overheated oils; oxidized lipids, which increase inflammation and arterial plaque buildup. These reactions aren't just theoretical. Numerous studies have shown that oxidized cooking oils are directly linked to a higher risk of heart disease, diabetes, and even neurodegenerative disorders like Alzheimer's disease, risks that increase with age. Real-life story: Jane's struggle with chronic gastritis. Meet Mrs. Jane Smith, an 84-year-old widow from Denver who had eaten fried eggs nearly every day for most of her adult life. "I've always believed in a hearty breakfast," she said. But in her late 70s, she began experiencing bloating, acid reflux, and a persistent burning sensation in her stomach. Doctors initially suspected age-related digestion issues, but despite trying various medications, her symptoms persisted. Eventually, a gastroenterologist traced the issue to her daily habit of frying eggs in vegetable oil at high temperatures. The combination of denatured proteins and toxic oil byproducts had irritated her stomach lining over time, leading to chronic gastritis, inflammation of the stomach wall. Once Jane switched to boiled and poached eggs, her symptoms began to ease within weeks. She even reported feeling more alert and energetic in the afternoons, a bonus she hadn't expected. Why seniors are especially at risk. As we grow older, our body undergoes several changes that make it harder to handle heavy or harshly prepared foods. Stomach acid production decreases, making protein digestion more difficult. Enzymes that help break down fats and proteins become less active. The gut lining becomes more sensitive, making it prone to irritation. Blood vessels lose elasticity, and inflammation from oxidized fats can hasten artery stiffening. The liver metabolizes fats more slowly, which can lead to higher cholesterol and triglyceride levels. This means that high heat frying, especially in oils like canola, soybean, or sunflower, introduces not just poor digestion, but long-term risks that compound with time. What's the healthiest way to cook eggs? To preserve the nutrients in eggs and prevent digestive or cardiovascular problems, opt for low-heat, oil-free, or minimally oiled cooking methods such as boiling hard-boiled eggs by placing them in cold water, bringing it to a gentle boil, then simmering for 10 to 12 minutes. Preserves nearly all nutrients. No oil, no harmful byproducts. Easy to digest and versatile for meals and snacks. Steamed eggs are popular in Asian cuisine and result in a light, custard-like texture, ideal for seniors with weak digestion or dental issues. Gentle cooking preserves choline, vitamin D, and other sensitive compounds. Poaching involves gently cooking eggs in simmering water. No oil required, great texture and high nutrient retention. Microwaving, use caution. Microwaves cook unevenly and can cause proteins to become rubbery. There's also a risk of explosion if eggs are not pierced or covered properly. If using a microwave, keep power low and always use a microwave-safe container. Smart oil choices. If you must use oil. If you still prefer the taste of pan-cooked eggs, choose oils with high smoke points and health-supportive fats, such as avocado oil, smoke point in 520 degrees. 200 rich in monounsaturated fats. Ghee or clarified butter, stable at high heat and rich in fat-soluble vitamins. Extra virgin olive oil for light sautéing. Avoid using it at high heat. Also, keep the flame on low to medium, and never allow the oil to smoke or discolor. Nutrients lost at high heat. Frying eggs at high temperatures significantly reduces choline, essential for brain function and memory. Lutein and zeaxanthin. Protect your eyes from age-related macular degeneration. Biotin, critical for nerve health and metabolism. Omega-3 fatty acids, beneficial fats that support heart and joint health. For seniors, preserving these nutrients is vital to preventing cognitive decline, joint stiffness, and vision loss. Practical tips. Here's how to make your eggs both delicious and senior-friendly. Boil or poach eggs for optimal nutrient retention and gentle digestion. If pan cooking, use low heat and a healthy oil like avocado oil or ghee. Avoid reheating cooked eggs multiple times. This increases oxidation. Add anti-inflammatory herbs like turmeric, parsley, or black pepper to enhance benefits. Avoid pairing fried eggs with processed meats or white bread. Instead, add veggies like spinach, onions, or tomatoes. Conclusion. Eggs don't need to disappear from your plate, but they do need to be cooked with care, especially as you age. High-temperature cooking with unstable oils transforms eggs from a nourishing superfood into a potential health hazard. By making small changes, switching to boiling, steaming, or poaching, you can safeguard your digestive health, reduce inflammation, and retain the brain, heart, and eye-supporting nutrients that make eggs such a valuable part of your diet. A fried egg might satisfy your taste buds today, but a gently cooked egg protects your body for the long run. Eggs can be a powerful part of a healthy diet, but how you cook them matters, especially as you age. Frying eggs in high-temperature oil destroys nutrients, makes digestion harder, and produces harmful compounds that can quietly damage your health over time. Instead, opt for gentle methods like boiling, poaching, or steaming. These preserve the egg's nutrients and are much easier on your digestive system. If you must pan cook, use a healthy oil and low heat. With just a small change in how you cook your eggs, you can keep enjoying their benefits, safely and deliciously, for years to come.